As we connect here today, we acknowledge we are on Treaty 6 territory and the homeland of the Métis. We pay our respect to the First Nations and the Métis ancestors of this place and reaffirm our relationship with one another. And one way for us to reaffirm our relationship with one another and promote reconciliation is by doing research that matters for Indigenous people. With this in mind, I have elaborated my research question, which is how is healthcare access for First Nations living with inflammatory bowel disease, IBD? So IBD is a chronic condition that causes the inflammation of the gastrointestinal tract. People living with IBD, they experience a great increase in quality of life due to their disease symptoms such as upset stomach and fatigue. People living with IBD, they need to seek healthcare as early as possible so that they can prevent possible complications and increases in disease severity. So that's why we're looking at healthcare access for First Nations with IBD. And to study that, we are looking at the Health Administrative Databases of Saskatchewan from 1998 to 2017. This is a patient-oriented research project, and we have the privilege of having Indigenous patients and family advocates partnering with us as we do this research. And they have actually helped us to choose the outcomes of interest to study healthcare, which are outpatient gastroenterologist visits, colonoscopies, IBD medication claims, and IBD-related hospitalizations and surgeries. So we hypothesize that because of colonization, Indigenous peoples experience delays in accessing healthcare and barriers when they try to obtain a visit from a doctor. They might experience a delay when they try to access a colonoscopy or a medication, and they might actually experience more IBD-related hospitalizations and surgeries because of complications. We know that Indigenous people experience overall barriers when trying to access healthcare because of colonization. That creates prejudice, racism, and stereotypical conceptions about Indigenous people. Besides, they have different ways of knowing and healing. We expect that this project will raise awareness about healthcare access for Indigenous people with IBD, and is going to help healthcare systems to improve their work so that they can better assist this population in a timely manner. Thank you.